Alright, so start off, walk out to Skippy while he's out there on the court. Ask him where it hurts, ask him to point to specific places that it hurts, if there are any. Other than that, ask him what kind of pain he has. If, like, the intensity scale of 1 to 10, shooting, burning. Ask if he had heard a pop when he came down on it. That could mean that there might be a meniscus or a ligament tear there. Ask if there's any tingling shooting down his leg. That might mean there's a fracture and that it hit a nerve or something like that. So not too much to ask since saw what happened. Exactly. After that, you'll look at both legs, both knees. Just happened, so there probably won't be much swelling if there's any swelling at all. You might see physical deformities, especially if there's a fracture. Or the patella is moved. Ask if that's normal for him. You probably don't have him walk around on it right now. But when you're taking him off the court, you can look to see if there's any guarding. So if his toes going in or going out, going in, trying to guard for the MCL, out for the LCL or medial or lateral meniscus. So after you can do this, depends on if he's still hurting pretty bad or not. If he is and you don't want to take him off the court, you can do some palpation while you're out there. Probably want to ask him also at the beginning to let you know if the pain subsides at all. So you just start with the uninjured leg and you just palpate wherever it doesn't hurt. Since he's holding above and below his knee is probably everywhere, which is a pretty big sign that it's at least the ACL maybe, and probably more than that. The MCL, CL, maybe the meniscus as well. So probably start feeling back behind the knee. Be really gentle since it is probably a pretty big injury. Start up above the patella and go around right on top of it, and feel down the medial and lateral epicondyles for that MCL and LCL. And watching their face for any grimacing. You can feel right for the meniscus, right on the joint line. Down here on the patella tendon, see if there's any tightness or anything there. And at this point you might want to do a squeeze test, see if there is a fracture in the tibia or on the patella. And if there is, then probably don't want to continue. Just get him in a stretcher and send him away, and then they can do an MRI later for the rest of that stuff. If not, help them off. Start off, you'd want them, and while you're palpating, I guess you want to be laying all the way back. So their leg relaxed. So do all that with the leg relaxed while they're laying back. There's no flexion in the hip. We don't have enough room here to show that. Yeah, you do that leg, and then you do the right leg. Make sure that they're relaxed. Just drop your foot into my leg, into my hand. Just relax. Perfect. And then just do the same thing. You can see that. Start behind, above all the soft tissue around the patella, medial and lateral epicondyles, on the patella, patellar tendon, the meniscus. Watching their face for any pain, making sure that they're relaxed. Once you're done with that, just the first test, and you start with their uninjured leg. Just do a valgus test. So you stabilize their ankle, other hand on the outside of their femur. Start with their leg straight and have them relax. And you're just looking for laxity, testing for that MCL. Do that 90, and then also have them flex to about 30 degrees. That isolates it more. Let me just test that. There we go. Do that on both legs. Thank you. Just relax. Just drop your, and Skippy here, his left leg's a little bit more lax than his right leg. I can't see that very well. And you do the same thing, Varus, except you're on the inside. You probably won't be able to see this side very well on the camera. But the same thing, relax your leg. There you go, perfect. You're isolating that. Looking for the laxity in the LCL. Doing it at 30 degrees. I don't remember if I did that other one at 30 degrees. Do this foot. Start off with 90. I think I forgot to do this one at 30 degrees also, so do that one again. After that, we'll try if you want to scoot back a little bit, Skippy. How you feeling? Good. So if you want to put your foot down, just relax. Don't worry. Okay, we'll test for the ACL. So we'll do this anterior drawer test. We'll just pull that straight back. Normally be sitting on this foot trying to keep it from coming forward. We'll just lean against it here. Other foot. Back there. And you're just pulling. Same thing, looking for any laxity in there. While we're here, probably wasn't a PCL injury, but since he did land with his legs straight and it was not bent. Another question you could ask him also is if they felt any twisting when they landed, to help isolate which side of the knee to focus on. Yeah. PCL, it's the same thing, but you're pushing it straight back. You're feeling that in the back, if there's anything. Perfect. All right, after the needs test. So same thing, you have their foot stabilizing above the knee on the femur, and the other hand is right below the knee, and you're just pulling that forward. You're looking for any laxity there. Do that on both sides. I don't know if I did, yeah, I did do the piece on this side. You're just seeing if there's any extra movement. After that, you look for any meniscus damage. We'll start off by doing so. We'll have them sit down. You put your finger right on their joint, and you'll go lateral and out. And you're just feeling for any. There we go. There's the joint line. I'll do that again. Just feeling for any crepitus, any movement. We'll go inside. You feel it on both sides. You can feel it a little bit on Skippy here, this knee. Yeah, ask them if they injured their other knee at all, ever. And you do this one, push it back. Find that joint line, go in, go out, just feeling. Yep. good. Other tests for meniscus, you'll have them if you want to lay on your stomach. I'm not tall enough to do this super well. I'll just grab this chair real fast. Probably won't be able to see my face. Do the Ackley's test. Start with this leg. And all it is, just pushing down and rotating. If they feel any pain, then that might be positive. And do it with the other foot too. Push down and rotate it. In and out. Perfect. Won't have them do the Thessaly test because they are injured right now. Won't have them stand up, put much weight on there right now. Other than that, you can just do one last Godfrey's test just to make sure that there's nothing wrong with the PCL. So you want to lay on your back this time. The reason we didn't have them lay flat like this the whole time is because I didn't want to be on the chair the whole time. You just have their feet and you just relax. And then we're going to just bend your knees. So bend them. And you'll hold them looking like this. Pretty even. And he's not lying flat, so it's kind of hard to tell, but then you just look across. He's a little bit on one hip. There's not enough room. Oh, there you go. You're just looking for a sag. See if this shows that there's laxity back here on the posterior side. And that's it. You don't really need to test for any chronic stuff. And just send him, get an MRI. The end. Any questions, Skippy? Okay.